Hi, I'm Dr. Kelly Starrett with the Ready State. Have you ever sprained or jammed a finger and then just had that thing linger on in sort of low-level suffering forever? Yeah, it feels that way. So first of all, most of us have probably turned an ankle in our lives. You've stepped off a curb and done something, and what you think to yourself is, darn it, that's a bummer. It's going to take a couple weeks before it starts to feel better. We know that a minor ankle tweak usually takes 2 or 3 weeks, and a bad ankle sprain can take upwards of 4 to 6 weeks or longer if it's really bad. So the first order of magnitude business is let's go ahead and apply that thinking. Hey, my tissues are going to need to heal. I don't necessarily need to rush out and get my MRI. If I think it's broken, obviously go get a picture. But one of the things that we fail to appreciate is that the hand is full of a lot of motor sensory information, which means that, man, if we look at the area of the brain that's responsible for perceiving all the pressure in the hand, there are a lot of nerve endings here, which means that it's easily sensitized to a little bit of swelling, that swelling in this area, because of the brain, ends up sort of magnifying these little minor problems. And the other issue with the hand is that the hand is always at the bottom of a gravity well. And that means it's difficult to pump out the congestion, especially if I don't want to move my hand very much because it hurts because I've jammed a finger. Every single one of these little creases in my hand actually is also a little like a body's own rubber band that is useful for keeping your tendons from sort of bowstring out of position. But one of the things is that each one of those wraps of tissues, that rubber band, that retinaculum, ends up potentially trapping congestion after a swell. So if I've swollen, I'm injured. The natural inflammatory response of the body is swelling. And now if I want to desensitize and heal at the rate of a human being and not slower, I need to have a plan to restore motion and get some blood flow in and garbage out. And garbage out means just swelling, all the normal things that happen after you kind of jam a tissue system. Oftentimes people are just like, oh, I'll just buddy tape it, which can be really useful for protecting it, but doesn't necessarily help us to evacuate the swelling. Enter the H wave. What I've got here is just a pad on my palm, and I'm going to put one just here on the outside, my extensors. But if I felt better moving it to the inside, I could certainly do that too. I'm going to use just a single lead here, turn the machine on. I'm going to turn it on to low frequency. And then I'm just going to turn this up until I get a little comfortable contraction. Now, the first time this happens to you, you're like, this is very weird. What's nice about this is that I could actually go about my day, override those movements because it's not a big deal. And then as soon as I'm passive again, it's going to take over. What we're doing here is we're trying to create a muscle contraction in the hand and in the forearm. And the way we should think about this is the musculature of the hand is of course, just like your foot resides in the hand, but then the rest of that musculature that drives so much function is actually contained in the calf of the upper body, the forearm. And so just like if we were going to try to decongest an ankle, we would pump the calf or mobilize the calf to even potentially influence foot pain or heel pain. We'll do the same thing here. Just by putting a pad in the palm of the hand, I can get a really comfortable contraction here. And again, I could even just move this pad because it feels better on the back. And now I'm just going to get this kind of 2 pumps a second, comfortable, non-fatiguing model to help pump this up against gravity. Of course, I can put my hand up and I can wiggle my fingers, but this isn't really a great solution all day long. So what's nice is that I can put this in my lap while I'm at work. I could type and do what I need to do. And then when I take a break, it's going to take over again. And ideally, we're looking at managing congestion throughout the day. We're not waiting till the end of the day and then trying to get out the shovel and manage that congestion. Instead, we have little doses in the morning, maybe a little bit of a dose at midday and a dose in the evening. Even 20 minutes of pumping would be like me doing this for 20 minutes, which would be really remarkable. What's nice about this, again, very comfortable. I could even sleep with it if my finger was really swollen. But what we find is that when people have swollen fingers, they don't apply the same thinking that they're comfortable with ankles or knees. And in this situation, if we just get a little non-fatiguing muscle contraction using the low frequency of the H wave, we can get radically far ahead. And often, when we don't have any swelling, we actually don't have any pain. And it turns out that sometimes we actually do need to protect the joint, but we're not getting any pain because there's no swelling. Those tissues aren't sensitized. A reminder that a swollen finger heals slower than a non-swollen finger. So we definitely want to make sure that our healing isn't being rate limited by congestion just hanging around. So bottom line is, if you've got access to an H-wave, you can repurpose this anytime you jam a finger. Just a pad on the hand, one either on the forearm, on the inside or the outside, and pump away. And you can see that we can get that finger back in the game much faster.